Hello, today I will discuss and demonstrate on the Palmar aponeurosis. This Palmar aponeurosis is a modification of the deep fascia which you see in the palmar aspect of your hand, and this Palmar aponeurosis has got functions like it gives a grip to your hand, it enhances the grip of your hand, it protects the nerves and vessels of your hand. It also prevents the bowstringing of the long flexor tendons of the hand, and not only that, this palmar aponeurosis, it gives the origin for a muscle which is the palmaris brevis from its apex, and this palmar aponeurosis also will give some septas which will subdivide the palm into some potential spaces which are surgically important, and this palmar aponeurosis, it is a degenerated primitive insertion of the palmaris longus tendon. So, I will demonstrate the palmar aponeurosis on the cadaver. So, to demonstrate the palmar aponeurosis, I have made insertions on the palmar aspect of the hand, and I am reflecting the skin. Yeah. Now, this is the palmar aponeurosis, and this palmar aponeurosis, as I mentioned, it is a modification of the deep fascia, and this palmar aponeurosis has got two parts. This is the central thicker part which protects the nerves, vessels, and prevents the bowstringing of long flexor tendons. It has got a thinner medial part and a thinner lateral part. This thinner lateral and medial parts will cover the hypothenar and thenar muscles, and relatively it is thin in texture to allow the movements. Now, moving on to this central thicker part, which is also called as palmar aponeurosis proper. It is triangular in shape, where the apex is directed towards the proximal and the base is towards the distal. Now, this apex of this palmar aponeurosis, it is blending with the distal border of the flexor retinacula, and also it continues with this tendon. This is the palmaris longus tendon. And moving on to the base, if you see, this palmar aponeurosis, on reaching to the bases of the fingers, now each it will divide into 4 slips for the medial 4 fingers. So, this is one slip. If you want to see it, yeah, this is one slip band, this is one band, this is one band, likewise. It divides into 4 bands. Now, each band will again divide into superficial and deep slips. The superficial slip will be blending with the dermis, and it is also attached to the superficial transverse ligament of palm. Whereas the deep slip, if you see, this deep slip is again further divided into 2 bands. Now, each band will be attached to the deep transverse ligament of the palm, palmar ligaments of metacarpophalangeal joints, bases of the proximal phalanx, and they also blend with the fibrous flexor sheaths. So, this is the attachment of the palmar aponeurosis at the base, and in between these bands you can see this space. This space is meant to, the interval between these bands, it allows to transmit the digital vessels and nerves. These are the digital vessels and nerves in the palmar aspect, you can see here, okay. And not only that, you also find some fatty substance, fat also can be seen, which can be seen in the forcible extension of the fingers, where the fatty tissue bulges as a cushion. So, this is all about the palmar aponeurosis, and there is one clinical aspect of this you need to know is like inflammation to this palmar aponeurosis may produce thickening and contracture of the aponeurosis, which results the proximal phalanx and middle phalanxes are acutely flexed, and the condition which is called as the Dupuytren's contracture, which required some surgical intervention, like we have the partial fasciotomy will be done, or sometimes medically it is given some needling method, or steroids will be given to get corrected from this infection. Okay. This is all about the palmar aponeurosis. Thank you.